Cardiac work. Work is defined as force times distance. In terms of myocardial function, work is the stroke work, or the work that the heart performs with each beat. We could use myocardial oxygen consumption to measure the amount of work. Myocardial consumption correlates directly with the cardiac minute work, and the pressure work that the heart needs to deliver is much more costly and more oxygen consuming than the volume-based work. There are two pathological conditions we can talk about to describe this condition. The first pathological condition is called aortic stenosis. This is when there's a narrowing of the heart valves in the large blood vessels, particularly the aorta. There's going to be a greater oxygen consumption in the pressure work so that the left ventricle must work harder to squeeze the blood out. The mean aortic pressure is 100 millimeters of mercury, which is higher than the pulmonary arterial pressure of 15 millimeters of mercury. Another condition is systemic hypertension. Elevated arterial pressure inside the systemic circulation will cause some kind of blockage, so the heart needs to squeeze harder. As a result, the left ventricular wall begins to hypertrophy. Law of Laplace for spheres states that the pressure correlates directly with the tension and the wall thickness. However, it is inversely related with the radius. The equation could be shown on the right. P, pressure, is equal to 2 times h, the thickness, also known as height, times T, tension, divided by lowercase r, the radius. In systemic hypertension, oftentimes the left ventricle begins to hypertrophy. It gets bigger and thicker. In pulmonary hypertension, the right ventricle begins to go through hypertrophy. Cardiac output is defined as volume ejected by the left ventricle per unit of time, and it can be calculated with stroke volume and heart rate. We can also measure cardiac output using the Fick principle. Fick principle states that in a steady state, the rate of oxygen consumption in the body should be equal to the amount of oxygen leaving the lungs in the pulmonary veins minus the amount of oxygen returning to the lungs in the pulmonary artery. So cardiac output, CO, is equal to the total oxygen consumption on the numerator divided by the concentration of oxygen in the pulmonary vein minus the concentration of oxygen from the pulmonary artery. It can then be rearranged to be expressed as CO times oxygen in the pulmonary vein minus CO times oxygen in the pulmonary artery to get the total body oxygen consumption. Just remember that CO is going to be expressed as milliliters per minute. Total oxygen consumption in the whole body will be expressed as milliliters of oxygen per minute. And then the concentration of oxygen in the pulmonary vein or artery will be expressed as mLs of oxygen per mLs of blood.